I became a pediatrician to help families think preventatively and to ask better questions, as well as build resilient kids. And the practice that I walked into, or the model that I walked into when I first graduated, was not built for that. So if you read ingredient labels and you question antibiotics and you care about gut health, you have probably also felt this tension in pediatric visits before. So today I want to talk about how traditional pediatrics is actually structured, what you're actually going to run into, and why holistic pediatrics is different. I'm Dr. Ellie. My practice is Middle Path Integrative Pediatrics. I'm in Asheville, North Carolina. And if you are ready for all things holistic, then listen on. Okay, so first of all, I want to talk about how regular traditional pediatrics is even structured. And this is a question I get a lot. Why does it feel not aligned? So first of all, we have to talk about the relative value unit. So those of you who are not familiar with the medical system probably have no clue what this is. I did not know until I became a pediatrician and had to do billing for insurance and basically explain to the insurance company all my treatment plans, which is just crazy to start with. A relative value unit is basically a number that is assigned to you as a patient. That is crazy to start with because you literally are a number, okay? And then that number basically determines how much a doctor gets paid. So most of these numbers range from a level 1 to a level 5, but typically in pediatrics is a level 3 to a level 5. And on top of that, the more that you see of patients, the more you get paid. So doctors are being pressured by the insurance companies to have these practices where they're seeing literally 30 patients a day. And then typically what happens is there's somebody running a practice who thinks it's a great idea to also triple book you. So normally your visits are 10 minutes long. And then what happens is they're 3 minutes long, I guess, with 1 minute to do your chart note, because now you have 3 patients in a 10-minute slot, which is crazy. And these aren't necessarily bad doctors. They may not know holistic medicine. But as far as Western medicine goes, this is a system design problem. And this was a huge disconnect for me because I just kept seeing patients getting rushed in and out of the door, not getting their problems addressed, no root cause addressed, no natural medicine discussed at all, which is a whole other thing because, Western doctors just aren't really trained in other methods unless they've gone on to get additional training like I have. And nobody got the time that their children really deserve. And I noticed that parents, what they really are looking for, in my opinion, is time with their doctor, context about what's going on with their kids so they can make informed choices to have good alignment. They want preventive care so their kids don't get sick, so they're not running to the ER in the urgent care. They're wanting their questions answered, and they're wanting holistic natural care too. So most of the parents I sit across from are not looking for faster, they're actually looking for deeper, and they're wanting a model that works for them. So that comes to me. Who is my model for? And I'm speaking directly to you guys. I'm looking at you crunchy mamas and holistic mamas. If you're reading ingredient labels, if you're thinking about your kid's gut microbiome, if you're worried about their detox system, you're worried about MTHFR and you want to know what it is, you're trying to avoid unnecessary antibiotics, you want some root cause thinking, and you want to find intentional care, then you probably are looking for my practice. And I want to think about this a little bit more because I think this is sometimes kind of interesting. When people get pregnant, a lot of times I notice they do a lot of work, which is absolutely great. It's we're going to get a doula, we're going to get our midwife, we're planning our home birth, we're evaluating options is this hospital the right choice for us? Maybe we want that instead. They're doing nutritional changes so that the kid can be as healthy as possible. They're making, choices around high quality supplements and vitamins for themselves. And then the baby's born. And all of a sudden we're shuttling our newborn precious baby into a conventional care system. And why would you do that? I would argue probably because most people just don't know there's any other options. But the truth is, I think that when your baby is born, you want to keep your baby healthy. And so you want to be able to find a provider that can do that for you. So now that your baby's here, you don't want to just like quit doing all those things. You want to have someone that aligns with your values and can help support you moving forward. And this is true, like if you are a parent of older kids, you're still going to be really intentional about what you're doing, but you're just asking slightly different questions. Right? So usually it's like, why is my kid getting like recurrent ear infections and all I'm getting is a bunch of antibiotics and no answers? What do I do about behavioral problems that I'm running into? Is this normal? Is this something I need a supplement for? Do I need to look at their gut microbiome? Well, I don't know, but most of the time, what I get told anyway is that parents will go to their doctors and be told it's just a phase, nothing to do, don't worry about it, all of that. Same with ear infections. It's like, well, here's another prescription. You might not even be asking about like immune resilience. Like, how do I boost my kiddo's immune system? How do I keep them healthy? And the conventional doctor's just kind of looking at you like, well, I wasn't trained in that. Like, I don't really know. Just like they don't really know how to do nutrition because that's not really what they're trained in unless they've taken like additional courses or something like that. Or even like things like chronic constipation and you're just getting Miralax over and over and over. And you're like, well, isn't there like, should my child be like, are they deficient in Miralax or is like something more going on? You want to know, is this normal? How can I treat a root cause? What can I do? And the truth is, you need relationship based pediatric care to help with that. You need to have longitudinal care. You're going to need longer visits. Why? Because there's more to discuss, right? It's not just slapping that band aid on and then leaving the office, right? It's what's going on at home. Do you have environmental toxins? What are y'all eating? Are there things that could be irritating the gut? Are there things that are irritating the liver? Are there things that are irritating the brain? Like these are things that take time to learn. And that's not something you can do in a 10-minute visit. You're going to need direct access to your doctor. So, who's called up their doctor and been like, I can't get a hold of anyone? Like, I can get a hold of someone at the front desk and no one calls me back and I have no idea what's going on. And 7 days later, someone calls me back and they still don't know the answer. I mean, that's crazy. You want to be able to message your doctor directly, which I do in the patient portal, or call and get a response or a visit like within a reasonable amount of time, right? Like, a same day or next day sick visit, in most cases, I can accommodate that. In a lot of practices, not so much. You might be getting in a week later. And that's just crazy because you really want to have someone available when you need it. Another thing, too, is like you got to have a doctor that knows how to do root cause thinking. Like if this was not in their training, first of all, the insurance company doesn't pay for any of those services. So even if we wanted to take insurance, which I don't know, because I don't know if I want insurance directing my healthcare, but even if we wanted to take insurance, like they're not going to pay for natural first medicine, which is what I do. We do natural first when appropriate, of course, not in like an emergency acute situation, but for the most part, we're going to do natural first. We're going to do holistic thinking. We're going to do root cause thinking. We're going to think about your kid's mind, body, and spirit. What's going on at home? What's going on at school? All of that stuff, woven in with nutrition gives you a model that takes time. So you need that time with your doctor and you need that longitudinal care with your doctor too, because you need them there when you need it, not, whenever your child's sick. You need to keep them well and keep them healthy. And that's the difference, right? It's like a wellness model, not just like a reactive slap a band-aid on model, which I don't think most people are looking for. In addition, you don't want to deal with like pressures around doing treatments that you may not be interested in, like vaccines and antibiotics. You want to have a shared decision making session. And so, I'm not paid per visit. I'm actually paid to stay available to you. I'm paid to be your pediatrician. Okay. And why is this helpful? All right. So, all the reasons I mentioned. Also, let's talk about what it costs to like not do a preventive care model. Okay. So let's say you don't have anyone, heaven forbid at all, or you can't get in for weeks. And now you're paying $200, $300, $400 at the urgent care 3 times a year. You've run to the ER at least once or twice because, broken bone and then really high fever. So now you're looking at $1,000 per urgent care visit. $600, $900 in urgent care visits. And then not to mention like the mental load of trying to figure out everything alone. So, my model is all about catching patterns early, staying on top of things, and also supporting you so that you're not having these like, I've got to run to the ER, I've got to run to the urgent care, I've got a $200 copay because I've got this high deductible plan and I haven't met my deductible yet. And, not only that, cash price of a pediatric visit nowadays is $685. So it's just wild to think about. So, whenever I talk about this, I think a very reasonable question comes up, and that's, is it worth it if I don't really go that often? And that's, a normal question, and it's a good one to ask. And the truth is, this model is not designed to compete with copays. It is designed to replace reactive medicine with preventive, proactive, holistic care. Okay. So again, fewer urgent care visits, often no ER visits, less chaos, more reassurance, fewer unnecessary antibiotics. And then, that's when you realize that we're kind of shifting mentally to peace of mind, right? And that's what honestly families will tell me the most is it's not just dollars saved, it's the peace of mind they get from knowing that they've invested in their child's health care and their child's health. Because as we know, our child's health is literally priceless. If you have a sick kid, it's absolutely devastating. And you need someone on your side, especially if you're getting into dealing with like chronic illnesses. You really need someone on your side who's advocating for you. So we want to make sure that you understand why this kind of mental load takes a toll. Okay. So let's imagine this. The opposite could be true. Could be in a model where you're in a Google spiral, you're in waiting rooms with 300 sick kids, you're never seen on time, you're feeling dismissed, you're being told it's not a concern, just watch it. You're being told, or at least indirectly being told that you're crazy for asking questions around different kinds of treatments, right? But contrast that with being able to access me, talk to us, talk to our practice, talk to Brandy, talk to, a human rather than an AI chatbot for your child's care, and then you're heard and you're listened to and you're getting your questions answered. And another thing too, you guys, like this model is not for every family. It's really not. It's not for price for shoppers. Like if we're looking for bargain basement healthcare, this is not it. There are some clinics out there that are, for that type of situation, but that's not this. And it's, not really for families that only want to use insurance, right? Because I don't take insurance. It's also not for families that don't value access to me, preventive care, holistic care, natural care, functional care, or root cause care. So if you're in the category of wanting a really conventional doctor who gets your kid in and out and has like a more reactive approach to medicine, that's not me either. So you'll definitely want to find someone who fits that model. But the truth is, if you do value alignment with your doctor, if you value prevention, you value partnership, you value your child being known, you value them being a name, a human, and not a relative value unit, this starts with a fee infrastructure, and that's how you get it. So if you have been quietly wondering whether or not pediatric or functional care could actually feel different, that is usually a sign that you are not currently aligned with your doctor. So I would invite you to schedule a meet and greet. Let's talk more about what's going on with you and your kiddo. Alrighty? And we'll get to all those root causes and natural medicine care that you're looking for. All right, wishing you well.